if you're having problems with testosterone, for instance, if a gentleman's having, it's not the testosterone, it's the
No.
gentleman. It's the
Yeah,
gentleman.
right.
If you're having problems with it, it's you. That don't, adage when you're in a couple relationships, not you, it's me. Look, it's you, not the testosterone. And
Yeah.
what I'd recommend to get with is somebody like Dr. Winge that knows how to do it, I mean, and the clinical success just tells you everything you need to know. And
Mhm.
and so look, that's who you need to be with. If you're having problems, you have to get on forums, look for advice, or not getting what you think you should get out of it. Well, getting with someone like Dr. Winge, look, he's going to do it correctly, tell you how to do it correctly, he knows how to optimize hormones. But more importantly, what I see that he will do that many of these, I'm going to call them testosterone mills would do, they're just really, it's all about churning and burning. It's all
Yeah.
about the more I can sign up, the better. They'll just
Yeah.
kind of throw enough things at men, and a lot of them will feel better. Some of them won't. They have the problems. But look, a provider that really is looking out for your best interests is going to have an honest conversation with you.
Mhm.
He's going to have, I hate to use the word call you out, but he might tell you that, look, your exercise is not where you think it is
Mhm.
or where it should be. Your diet is not, even though you think it's good, it could be much better. And
Mhm.
so, you need almost a coach in a lot of ways, to help these men understand that it's not a magic bullet, it's not a panacea.
Mm.
The easy job is getting the hormones optimal, but
Exactly.
for them getting the results that they're looking for, man,
Yeah.
they got the hard job, that sweat equity, man.
Absolutely.
That sweat equity.
Absolutely. That's you hit the nail right. I was going to say exactly that. It's the hormones is actually the easy part. It's I definitely transition over into more of a coaching role at some point. It
Mhm.
might be 6 months in, it might be a year in. It just varies. Because once all that, the hormone part of it is taken care of, and if you're still not where you want to be, you have to look in the mirror at
Absolutely. A
that point.
critical analysis. I mean,
You
a
got to look
really
in the
hard
mirror.
look, a really hard look.
Yeah.